2007 article, actually, sorry, hold on. I'll make it easier for you guys. Can you guys hear me? Okay. In a 2007 article written for Bipolar magazine, Laura Dolan wrote about one of her experiences with mania. Quote, within weeks, I had lost touch with reality. At 1 a.m., I opened all the windows in my living room and blasted the music from Phantom of the Opera out into the neighborhood, all because I had discovered the real reason President Abraham Lincoln freed the slaves. In my delusional state, I had already written my acceptance speech for my Nobel Peace Prize, end quote. Most people understand what unipolar depression is, however, not many people understand what makes bipolar disorder different from unipolar depression. The past few weeks, I have been doing considerable amounts of research in the form of textbooks, journal articles, online sources, and even talking to some professionals. However, most of my experience on this matter comes from that of a more personal angle. When I was 19 years old, I was diagnosed with bipolar disorder, type 1, with rapid cycling and a mixed state. I moved home from Colorado, dropped out of school, and locked myself in my apartment for a year. I stand before you as a 23-year-old senior who will be graduating in the spring with a Bachelor's of Science in Biology and plans to attend graduate school to obtain my master's and PhD in neuroscience. Today, I want you to better understand bipolar disorder from a clinical and personal standpoint. So today, we'll be talking about what bipolar disorder looks like and feels like. Then we'll talk about some treatment options for bipolar patients. And then we'll finish it off by talking about the stigma of mental illness and how detrimental it can be to those of us on the road to recovery. The poet David Jones once wrote, and I quote, "It is both a blessing and a curse to feel everything so very deeply," end quote. That's the perfect encapsulation of how bipolar disorder actually feels to those of us with it. According to a 2015 article published on the National Alliance of Mental Illness, or NAMI's website, called Tell Me About Bipolar Disorder, they classify bipolar disorder as a mood disorder with severe swings in mood between manic highs and depressive lows. In order to be diagnosed with bipolar, you must have at least have had one episode of mania, and no, you don't need an episode of depression, just mania. 2.3% of the US population is diagnosed with bipolar disorder each year, and of those 7.5 million people, 83% of those cases are characterized as severe, which means that patients have had experiences with delusions and hallucinations. I'd like to show you guys a clip from the movie Silver Linings Playbook, in which Bradley Cooper plays a man who's dealing with the aftermath of being diagnosed with bipolar disorder. This clip perfectly encapsulates what bipolar delusions actually look like.
Yet they can be unstable.
Sorry about that.
Can you talk about something that you did before or after?
Yeah, about a week before the incident, I called the cops, and I told them that my wife and the history guy were plotting against me by embezzling money from the local high school, which...
wasn't true, it was a delusion. And we later found out from the hospital that's because I'm
Undiagnosed bipolar.
Mania is characterized by rapid thoughts, shifts in energy levels, so people can stay up all night long. You have racing thoughts, ideas of grandiose, irritability, a lot of engaging in risky behaviors such as excessive spending. I'd like to show you guys a PET scan of what is actually occurring in the brain during bipolar. As you can see, the scan on the left shows a depressed state, and this scan shows decreased levels of activity in the brain. As you can see with the scan in the middle, there's a high activity of neuronal activity occurring in the brain, which is which shows up during a manic state. But what I want you guys to take mostly from this slide is that there was 1 day in between the first and second scans. And as you can see, it only took 10 days for the patient to return back to their depressed state. Now that I've discussed what bipolar disorder looks like, I'd like to go into some treatment options for those of us with bipolar. According to the 2015 article by NAMI, the most popular treatment option is medication. And of those medications, the most popularly prescribed are mood stabilizers, antipsychotics, antidepressants, and anti-anxiety medications. When medication doesn't work, there's also electroconvulsive therapy. And while that may sound really scary, it's nothing like the scenes from One Flew Over the Cuckoo's Nest, I promise. Another thing that really makes a difference is eating well and exercising regularly. When I take care of my body, my bipolar disorder is much more manageable. And also having a 4-year-old black lab Great Dane as certified as my therapy animal doesn't help either. He's a lifesaver and really cute. Now that I've discussed the treatment options, I'd like to explain to you guys what stigma is. According to the Merriam-Webster dictionary, stigma is quote, a negative and often unfair set of beliefs that a society and a group of people have against something, end quote. Stigma is detrimental for those of us trying to live a healthy life with mental illness. The J. Walter Thompson Foundation did a study and found that 4 out of every 5 people are more ashamed to admit to having a mental illness than any other disease or disorder in medicine. They also found that 1/2 of people who meet someone with a mental illness are scared of that person. Further, in a 2015 journal article published in the Annals of Epidemiology, researchers found that a majority of people with mental illness are unlikely to engage in violence against others. Even more so, in an article published in the February of 2015 version of the American Journal of Health, researchers concluded that a vast majority of gun violence is carried out by non-mentally ill people. And to conclude this, in a 2014 journal article, it also published in the American Journal of Health, researchers found that, hold on. I'm feeling a little manic right now, okay, so there you go. They found that most people with mental illness are far more likely to be the victims of violence than the perpetrators. So now that I've explained to you guys what bipolar disorder looks like and feels like, and what the options are for treatment, as well as talking about what stigma is and how it can hurt people, I'd like you guys to take a look at me and think, when I was diagnosed with bipolar disorder, I thought my life was over. I thought that everything that made me who I was up until that point would crumble into a million tiny pieces on the floor. Little did I know that when I was diagnosed with bipolar, my life was just beginning. Yeah, it may be a little bit more dark and twisty than I thought it would be, and I'd have to wade through a little bit deeper water. But if I would never have been diagnosed with bipolar disorder type 1 with rapid cycling in a mixed state, I never would have found the passion to pursue a PhD and master's in neuroscience, with my research specifically focusing on the molecular, physiological, psychological, and biochemicals of bipolar disorder. To conclude, it took me a long time, but in the wise words of Dr. Bren Brown, from University of Houston research professor, quote, I now see that owning our journey and loving ourselves through that process is the bravest thing we will ever do, end quote. Thank you.